so today we are looking at 9 prescription meds or medications that could kill you. All right, so I'm not making this video to put you off from these medications if you are found to be on any of them, but I'm actually increasing your awareness of the dangers that these medications they could give to you even as you keep taking it. And of course, I'm going to be talking about the chronic use of it. So let's just get this from the start that I'm not telling you to get off your drugs, but I mean in the course of you getting the information and also increasing your awareness, you can actually have a very clear idea even as how to talk to your doctor when you are put on this medication. So let's just get it from this perspective, and I think that it's really going to help. So the first one that I like to talk about is corticosteroids. Corticosteroids, typically steroids, and I'm not talking about the kind of steroids that bodybuilders take. I'm talking about the other kind of steroids that we normally take for inflammation. The typical steroids, like I said, one of its most common uses, it's for inflammation, and it's normally known as the silent killer. Of course, it's used to, for inflammation, for psoriasis, autoimmune diseases, asthma, and so on. So normally we take these typical steroids that are also known as the silent killers in these conditions. So you realize that somebody's having psoriasis, somebody's having an autoimmune disease, somebody's having an allergy, somebody's having kind of inflammation, and we go and take the steroids. And actually this is what the steroid does to the body, and they are called the silent killers. And of course, like I said, I'm talking about the chronic use of it, not just the one-time use of it. So the side effects of its chronic use can also bring about loss of appetite, moon face development. Like moon face is actually when your face becomes very round, and there's also a belly fat development, there's a buffalo hump, there's also a thin skin, and there's an increased risk of infection, mood changes, and we can also talk about osteoporosis. And there's a suppression of your adrenal glands, and the worst side effects of it all is a suppression of the bone marrow that can lead to suppression of your immune system. So people end up dying from very simple and mild infections. So the next one that we like to talk about is chemotherapy. The type of chemotherapy that I like to talk about is the systemic anti-cancer treatment. The systemic anti-cancer treatment is when you are taking a certain type of chemotherapy that affects your whole body. And normally the person is put on the drug for like a period of a month, or let's say 30 days. And so that means that the person could die in a 30 days period, or the person may survive. So the chances of surviving is very minimal. And we need to look at this kind of medication. It's a very sensitive therapy that we need to be aware of, because the chemo kills you even more than how much the cancer is going to kill you. And it's able to destroy and disrupt your immune system. And so if you are going to undergo any this particular kind of chemo, you need to discuss with your doctors, and you need to know what it's actually about. The third one we are looking at is antidepressants. 1 in 8 people is actually on an antidepressant. They increase your risk of dying prematurely by 33% with SSRIs. And when you add an alcohol to an antidepressant, it can increase your risk of dying prematurely to 70%. And so the side effects of the antidepressant, which we are talking about drowsiness, we are talking about lightheadedness. So talking about antidepressants, it's possible to cause a situation called serotonin syndrome. That is when the levels of serotonin in your blood is too much. So it has the potency of destroying your vital organs, and that may lead to death. So we need to be aware of that. The fourth med that we like to look at is bromocriptine, which is used to treat Parkinson's and also treat high levels of prolactin in the blood, which can actually lead to something called lethal circulatory collapse. This situation is when your blood flow stops and as well as a situation called sudden sleep. Just like I'm talking to you right now and I just go off like that. So bromocriptine can actually bring about this situation, and that is something that we need to be very careful. So let's say you are driving and you are on this drug and suddenly your blood flow stops and there's a sudden sleep and then you sleep. You go off like that. What's going to happen? So we need to be very careful on that. The fifth drug that we like to look at is clarithromycin. Clarithromycin is actually an antibiotic of the class macrolides. And this medication can increase your risk of dying prematurely by 27%. How is it possible? The chronic use of clarithromycin can actually increase your risk of dying prematurely by 27%, mainly of cardiovascular incidents. It can even occur after you stop taking this medication, that is clarithromycin. So I don't know about you, but I don't like the risk factor, so I wouldn't try that drug. Yeah. So we need to be very careful about it. Yeah. The next drug we are looking at is clozapine. Clozapine is a drug used to treat schizophrenia. This drug has a high risk of major side effects, including myocardial death and also a situation called slow gut. The slow gut situation can actually cause severe constipation and the person might even die. So this drug, you need to be aware of the dangers, of course, the chronic use of it. So that's something that we need to look at. The next drug we are looking at is humira. Humira is the #1 selling drug in the United States for inflammation. It's on a very high demand. This type of medication, of course, that's the humira, is actually a biologic drug, and it can destroy and disrupt your immune system. And mind you, it can be very lethal when you have TB and you take this drug, humira. It's really not advisable. The next drug we are talking about is colchicine. Colchicine is a drug that is used in the treatment of gout. The FDA of America has put a very high risk on this medication because it has a significant toxicity even when taken in a very small dose, like 35 milligrams. And so we also have to be aware about this medication. The last medication that we are talking about is digoxin. Other brands, they come in several brands. Of course, we also have the lanotsin, but they are all the same. The generic is digoxin. This drug is actually used in the treatment of cardiovascular failure and atrial fibrillation. And that's something that we can't risk our lives around like that, especially when you combine digoxin with quinidine. It's very bad. It could kill. It will become a very lethal weapon. So I actually brought up this video to increase our awareness, and then if you're on any of these medications, you need to talk to your doctor and then make a review of the drug if it's the best option for you and not just taking it anyhow. And I really hope that it's really going to help us. Thank you so much for making time to watch. If you like this content, you can subscribe to this channel. Just click on the link, subscribe to the channel. And if you have any question about what I've just spoken about, just put it in the comment section. You can like this video, you can share it to help someone. Thank you for watching. See you another time. Bye-bye.